Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. I'm Coach Kyle.
And I'm Dr. K. This is really the first episode that we're recording this year, even though you guys aren't going to see it until like mid-February. What are we talking about today, Kyle?
Well, we're going to talk about VSELs, but before we get into this, I have to address the blue elephant in the room. And you can probably see in my camera right here, I am actively dripping methylene blue on podcast, live recording.
He is so excited about that. It was like his goal.
Yeah, I mean, mental sharpness. Hopefully we didn't overclock the dosage, though, because then I'm going to be like, in the middle of the podcast.
We gave him 100 milligrams, which is, he takes 180 orally, but the conversion of IV to oral is roughly like 4 to 5. So he's taken like, I don't know.
Like 400 or 500, something like that?
Yeah.
Somewhere in there?
We put it in a big bag. It'll probably take you an hour to finish it. So if he starts puking, you guys will see it on camera.
There we go. Then you'll know I overdid it. So, but that's part of being a biohacker, as you can see on the shirt here. Biohacking. I was talking before we opened up the podcast. This shirt was actually the conference. I got this shirt at the conference that I met the doctor who introduced me to you, who you found my mercury poisoning and fixed me. So I am very grateful to this shirt in this conference.
So what I told him is I'm confiscating that shirt, and every podcast going forward, that'll be his podcast shirt.
There we go. Podcast shirt. I like that. That's cool. That's cool. So back to the matter at hand. VSELs.
What's a VSEL?
I don't know. You know?
I do know. I hope so, because we're going to get them next week.
Yeah, that's fair. You want to intro it or you want me to?
Yeah. So VSEL, VSELs. It stands for very small embryonic-like cells. And basically what I've been explaining them the last couple of weeks. So I've been so excited. I've been telling all the patients here that they're coming, trying, get the patients interested. So someone actually does these things. But basically they're the body's emergency stem cell backup system. So they're floating around in their bloodstream all the time, but they're not really active. And when we go through a big stress response, our hormones will force them to turn on. And when they get turned on, then they become stem cells. And stem cells, is a marketing word, but it allows them to almost be plastic-like in that they can go and heal other tissue. So what are we doing? How are we getting them?
Yeah, so that's a good question. So as far as I know, there are two methods by which you can activate these very small embryonic-like cells, these VSELs, in your blood. One of them requires like a cryo freezer treatment thing, and it takes some time. And the other one is a laser-based system. So we're actually going to be offering at the Longevity Center the laser-based system. Yep. And this was a system developed by Dr. Todd O, and I will not say the full name because it is Greek and I cannot pronounce it correctly. But what he did somehow, and I'm going to try to explain this the best way I can because he's one of those science brains that's like a couple leagues above the rest of us.
Take your best stab at it, and then I'll explain it how I've been explaining it to patients.
There you go. So he developed a laser that this frequency, the specific wavelength and frequency of this laser, activates these cells. And so because of the way the light is interacting with the cells, it turns on the reparative properties of these cells, activates them. And so that's the easiest way I can say about activating them.
I mean, yeah, pretty much that's the laser stresses the stem cells. So what we do is we take your blood, we spin it down just like PRP, and the V cells are caught inside that platelet-rich plasma. And then when we shine the laser on them, it stresses these cells and to force them to turn on. It tricks them into thinking that they're being stressed. But in the process of that happening, the laser's frequency, it begins to attract the V cells to it, so they become really attracted to that frequency. And so what happens is then you put them back in by IV. You don't have to directly inject them. You put them back in IV, and then wherever you shine the laser, because it only takes a red blood cell 45 seconds to run all the way through your body. So these V cells, they're moving quickly. And so wherever we shine the laser on your body, it might be your heart, your pancreas, your prostate, your ovaries, whatever you want is where the V cells will attract to. And are we capturing 100% of them? No. But also doesn't really matter as long as we're capturing a big concentration of them.
Okay, so this is really where the two kind of forms of V cell, because if you look in the literature, you see both types of V cell treatments in there. This is where they differentiate. So the cryoactivated system for V cells is not able to be targeted in any way.
No.
So it's more like a stem cell IV.
Yeah, so when you do those, it's basically the only reason you would do cryogenic type V cells is basically you want IV stem cells, but you don't want someone else's stem cells. But otherwise, they're entirely equivalent. And truthfully, using your own V cells without guidance is far inferior to using someone else's, because as we age, yes, our concentrations and our qualities do decrease. Concentration way more so than quality, but they both do decrease. And so the main upside is the guidance system.
Yeah, so like if you were comparing it, if you were just going to do IV stem cells, you might as well get those fresh, healthy, cryopreserved stem cells from someone else rather than your own, because most likely you're going to have a higher potency effect.
Yeah, and you have guaranteed counts.
Guaranteed counts, that's nice. Whereas, life and aging and toxins probably reduced your counts to some degree. So, but like you said, if we can guide them, then there is a benefit over IV stem cells because we can actually tell them, hey, go here.
Yep. And so when we say IV stem cells, we mean MSCs, exosomes, umbilical cords, culture expanded. Literally, we're just grouping all that under stem cells. I just want to make that distinction because stem cells is technically a marketing term. There's no such thing, or there is such a thing as a stem cell, but that's not what we're using. So in this world, stem cell is a marketing word for umbrella term for all those other things. I just want to make that clear.
Yeah. I mean, that's a pretty good distinction in my opinion, because if you look at stem cells, if you just say stem cells, you could be talking about 50 different things. So we're just using broad comparisons here.
Yeah.
So the laser guidance system, at one point I do want to throw in there is the specific size of these cells. They're very small embryonic-like cells. So if we can break that
very small.
Yeah.
Very.
So if we could break that down into two parts, one, the small part. Very small cells. What does that mean? It means they can travel quickly and anywhere in the body, meaning they can cross the blood-brain barrier.
I think their max size is what, like 10 microns?
Yeah.
So for reference, exosomes are between 10 and 100. MSCs are between usually 10 and 60. So these are way smaller.
Yeah. So they can easily travel anywhere in the body, which makes it applicable for brain type treatments, eye type treatments, things like that, because you can actually get them there through the laser guided system. The other part of that term is embryonic-like. So these are pluripotent cells, to my understanding. Is that how you understand it?
They're pluripotent, which means that they have the ability to turn into many different types of, not infinitely any cell, but many different types of cells. Basically anything that can be made from our blood, they can turn into, which is quite a lot.
Yeah. So it's not like it can grow random masses like some of the truly like omnipotent cells.
No. And what's cool is it is your own cells. And so there's they can't turn into something that your body wasn't already forming.
Okay.
Because your body's still going to direct them. The laser will target them towards an organ. It doesn't tell them what to turn into.
Gotcha. So they kind of figure it out on their own. Once we get them to where we need the repair to happen, the signaling, the body will take care of the rest.
Yeah. The nervous system and other cell signaling will control what happens wherever they land.
Okay, very cool. So why don't you talk about why someone does this?
Yep.
What's the goal? Like who's the right person to consider this?
Yeah. So the point of V cells is you want guaranteed guidance. So when you do regular IV stem cells, your body's going to concentrate them towards the highest area of inflammation. It might be your heart, it might be your pancreas, it might be your stomach, whatever. And the way I always explain those is I had a patient, and she was the best case. I'll talk about her the rest of my career. She had brain fog and neuropathy. And she was thinking about doing the IV stem cells. And she's like, well, my brain fog go away. And I was like, truthfully, I can't guarantee where they're going to go. And she's like, you know what? I want to try it, see what happens. But I really hope it goes towards my brain fog. And so we put in the IV stem cells. She she goes away. She comes back next week. I'm like, what's changed? And she's like, well, I still have my brain fog. I'm like, okay, but we knew that might happen. But what else has changed? She's like, well, I guess the neuropathy's gone, but I didn't really care about that. I'm like, you mentally didn't care about that, but your body chose that as the higher area of priority.
There you go. So neuropathy, which is something that people struggle with quite frequently, and there's really no good solution to knocking it out, was essentially fixed in this patient because the body sent the signal, and that's where the stem cells needed to go.
Yep. So, but now that leads me to VSELs and what makes them so special. If you want to guarantee your location, you do VSELs. If you know you want your brain fog to go in, you don't care about your neuropathy or your colitis or whatever other issue, you do VSELs and you guide them only towards your brain. A woman in her late 30s looking to get pregnant, VSELs towards the ovaries. Same for a guy that's getting on in years and wants to enhance his sperm health, testicular VSELs. Or prostate VSELs for an even older guy that's struggling with prostate issues. If you have GI issues, Crohn's, ulcerative colitis, IBS, you can guide it right towards your intestines. So that's where the possibilities become really big.
So let me give you a scenario. So patient comes in, and this is completely hypothetical, but a patient comes in and they are told, hey, you need to have surgery to remove your gallbladder because it's sluggish or filled with stones or whatever it might be. Would that be someone who might want to try VSELs before doing a surgery?
Well, you just gave two different scenarios, and that's where it gets interesting. Sludge, yes, because that's an underperforming gallbladder that isn't properly contracting to squeeze out the gallbladder juices. Stones, no. If you're full of stones, the VSELs aren't going to break down the stones. So if you have stones, go do surgery. There's nothing I can do for you. Because I know there's diets, this is a sidetrack, but there's diets to squeeze out the stones. But if the stones are too big, those diets will actually lodge them in the duct of Oddi, and you're actually having emergency gallbladder surgery.
Which is not good.
No, you don't want that. You want the surgeon nice and calm and prepared for you. You don't want them waking up at 2 a.m. to deal with you. But sludge, I think there's a much higher probability of that actually being able to help. Okay,
that's very cool. Yeah, so it's really any organ system in the body. So, my next question is, use in cancer patients, for example, because a lot of cancer patients have organ shutdown or organ struggles because of the treatment for the cancer.
Yep. And so that's where I think VSELs has possibility, and this is where Dr. Todd may disagree with me, so I definitely don't want to step on his toes. But my philosophy towards this, and I could be wrong and he might correct me, is that they're already in your bloodstream, right? So if the cancer was going to use them, it could anyway. So if we take them out and activate them and then guide them to, let's say you have, stomach cancer. If we take them out and guide them towards your kidneys, they're going to heavily concentrate towards your kidneys. They're not going to feed into the stomach cancer. But then even if the stomach cancer does grab them, most likely it was going to grab them anyway, regardless of whether or not we guided them towards the kidneys.
Yeah. Well, and I think that's a pretty good distinction because if you compare it with like traditional PRP injections, how would the risk vary there?
I think the difference is that, so when you do PRP, that brings up a really good point. So VSELs, remember, when we take out your PRP, make PRP activate the VSELs, put it back in IV. If we picked up a cancer cell in that blood, we're just putting it right back in your bloodstream. We didn't do anything to that cancer cell to make it more potent, right? But so if we did regular PRP injections into, let's say, your knee, and we picked up cancer cells and put it into your knee, a relatively isolated space, we just gave that cancer cell all the healing factors it needs to actually expand and grow inside your knee. That's the risk. Whereas if we put it back in your bloodstream, we're just putting it back where we found it.
Yeah, that makes a lot of sense. So you're not spreading cancer in the body.
No.
You're literally putting it right back where we got it from.
Yep. So I'm not saying that there's no risk. I'm just saying we don't change your risk.
Yeah. The risk is equal to before you came in.
Yep.
Okay. Very cool. Because I could see this being an amazing application for someone on chemotherapy whose, kidneys are struggling or liver is struggling from the treatment.
Absolutely.
I mean, this could be the difference between them being able to finish their course of chemo and not. And actually fight the cancer.
That's 100%.
Okay. So tell me about, and it's a little bit of a loaded question because we've discussed this previously. Tell me about musculoskeletal issues in VSELs.
So, my philosophy is the reason that tendons, ligaments, and joints don't heal is that they have bad blood supply. And so, when we try and guide V cells towards the area, they're still not going to enter the joint. And so, putting them in IV is going to it's going to throw them off. I don't think it's going to basically work as well towards a joint as you would expect. And so my vast preference, if someone really wants V cells injected, or V cells because they don't want someone else's stem cells and they want them injected, I will inject the V cells directly.
Okay.
Was that too rambly of an answer?
Yeah, so if I could summarize, you basically, because of the lack of blood flow to that area, you think it's not going to be as effective as organ-based treatment. Is that?
Yeah, I don't think that they'll process towards that area as well as we want. I'd rather take them, activate the V cells, and then directly inject them.
Yeah, so that makes sense. So I personally, being the biohacker that I am, want to test this. So I have basically undergone 3 or 4 rounds of PRP, maybe 2, I don't know. A lot of PRP on my foot and ankle. I have not done any on the other foot and ankle, which needs it. So I would like to test these V cells for the ankle joint and to see and compare like a normal course of multiple rounds of PRP versus IV V cells in my ankle and see the results.
Okay. So for reference, we don't actually have the VSEL technology. Today is a Sunday. We're flying out on Thursday to go get the VSEL technology, and we'll be back with it. So you guys will see the results in roughly 8 podcast episodes. We'll report back on the results.
Yeah, so we just don't know yet, but we'll do a follow-up after we've thoroughly tested the laser and ran it through our gambit of self-experimentation.
Yeah.
And as a side effect, and we've talked a little bit about this as well, V cells are very cool too, because you will actually be able to benefit from stem cell treatments because you're the only doctor here.
That's
so
true.
I can't stick you with a needle and inject you with stem cells.
That's true. And my personal commitment is I want to do IV stem cells every 3 months at minimum. And so, but with V cells, I might start doing them once a month.
Yeah. So that's pretty cool because you can literally have, your wife and both her and I will be trained on the laser activation. And so we will be able to actually assist you with that.
Yeah. Probably more so her than you. She's one of my MAs.
I'm just here, guys.
Yeah, he's just here. He's the health coach. We don't let him touch the needles.
No.
Don't worry.
No. I pull out an IV every once in a while.
Mostly his own.
Yeah, that's true. Okay, so back to V cells before we rabbit trail too hard. Is there any other considerations like you don't want to do this, contraindications?
And that's where I think going to learn about technology, off the top of my head, pregnant women are almost always a no-go, just always, for just pretty much everything. It's just better
never enough research.
Yeah. Other than that, if you had any type of blood cancer, sorry, but no.
That makes sense.
I can't really think of any other specific ones.
Okay. Yeah.
Probably if you're actively sick, I'm probably not going to touch you either.
Yeah, that makes sense. Probably decreased counts or already activating some.
Yeah.
Okay. Anything else the audience should know about V cells?
Nothing that I can think of. If you guys want, I obviously have a more in-depth discussion with the patients. Sometimes I'm like, hey, you want some V cells? And the patient's like, what's that? And I tell them, they're like, yes. But other times we have an in-depth discussion. And so I think that becomes a little bit more of an individualized discussion of like, what do they hope to gain out of it and all that stuff.
So yes, that's V cells. In summary, we're looking at, you pull your blood out, you spin it down to platelet-rich plasma, you hit it with a laser to activate these cells, you put it back in, and you point the laser to where you want them to go.
Yeah, basically.
And so essentially it gives us the ability to treat things with stem cells that we would not normally be able to stick a needle into.
Yeah, it's basically guaranteed delivery to organs.
Amazing. The technology, it just blows my mind. So if you guys want to learn more, feel free to comment on any of our podcast platforms, Spotify, YouTube, you name it, or call us directly at the Longevity Center. I'm Coach Kyle here with Dr. K.
Thank you, everybody, for joining us, and we'll see you guys next time.
Adios.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at PerformPod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.